All right, super pumped today. We have an amazing guest that is literally world expert in this area. She is Dr. Jolene Brighten. Most of you know her with respect to her really popular initial book that I think all of us have heard of, Beyond the Pill. And then now she's got an upcoming book, which I think is even more amazing because it's such a broad focus on all the things that make women women and what we should all know about women. Women should know about themselves. Men should know about women. I mean, all the good stuff, called Is This Normal? That's coming out soon. And I'm just so pumped to have Dr. Jolene Brighten here with me today. Welcome.
Yeah, thanks so much for having me. I love what you say about Beyond the Pill is great, but Is This Normal is even more exciting because when I was about to publish Beyond the Pill, my good friend, Dr. Isabella Wentz, who's also authored several books, I had to text her and I was like, I gave it all away and Beyond the Pill. I feel like I held nothing back and did I do too much? Did I give too much? And I was freaking out. I'm like, what if I never have anything in me again to write another book? And she is like, calm down. That's a sign of a really good book. And honestly, in writing Is This Normal? I was really proud of Beyond the Pill. Is This Normal? I'm like, oh my gosh, I'm so excited for this book. And it's even bigger. So Beyond the Pill was 80,000 words. This is 126,000 words. So that fear was unfounded. I have lots to say about women's hormones, health, sex life, libido, all of it.
That's awesome. And 80,000 is a super solid book. I know this as a fellow author. My initial manuscript was 180,000 and it's down. They actually, believe it or not, it's pared down to 80,000. So don't stress out.
Cut it.
Yeah. Yeah. When you guys get it, it's 80,000 words. It's totally doable. So Dr. Brighten, let's get into a little bit of the backstory. I think I'd love to have you share a little bit on a personal note, how you got into this whole area of natural medicine and of course the women's health piece and all of that. Just tell me a little bit of the backstory.
So my background is actually in nutrition science. So I'm a nutrition scientist. I also have a degree in chemistry. So I'm a big time nerd. But I struggled a lot with gut health. And it was when I was doing my research in my master's of nutrition, I was actually studying sarcopenic obesity, how to use branched chain amino acids to combat that. Something that's a really hot topic now. 20 years ago, when I was studying it, people were like, whatever. This is eating protein is going to help you live longer. Nah. So I was studying that, but it really became apparent that no matter how much research I did, no matter how many peer-reviewed studies you had, clinicians weren't going to accept that, bring it in. It was going to take almost 20 years from the integrated, if they ever got the time. And so I realized if I really wanted to change health and people's health, I needed to be on the ground doing that work as a clinician. And so I discovered naturopathic medicine, which I'd never heard of before. I first was going to go to school to be a dentist. Then I got bit by a dog on my right hand. So that couldn't work because that's my dominant hand. And then I was going to go to medical school. But once I found naturopathic medicine, I was like, they actually integrate nutrition, which is my background. There was no functional medicine back then. There was nobody doing lifestyle medicine back then. And so that's the path I took. And the funny thing is I was like, I'm going to study gut health because that was my struggle. That was my history. And then I remember having this epiphany of sitting in class and realizing that so often women's medicine is done to them, not with them. There's no partnership. It's very dogmatic. It's very much I wear the white coat. You do what you're told. Be a good girl. Don't question your doctor. And the choices were just the options weren't there. They weren't being given options. And it was really in that moment, as I'm studying endocrinology that I'm like, why am I not doing this? I love chemistry. I love biochemical pathways. Organic chemistry was one of my favorite courses. Anyone who has been through it usually is you're sick, you're sadistic. What is wrong with you? And I'm I love OChem because I love these complex pathways. I love nutrition and studying the science because I love the biochemistry of it, the complex biochemical pathways. So when it came to hormones, it just clicked for me. And that is something that I realized in that I lecture with clinicians all over the world. That's not true for everybody. Sometimes I have people in the audience, I can just see their eyes glaze over where they're like, why are you showing me this diagram? And I'm like, friend, by the end of this, you're going to understand all of this and you're going to be an ally to your patients. But I understand when you start seeing molecules, you have PTSD from the undergrad days.
Yeah, no, I share many of those things. You probably didn't know this. I also have a degree in chemistry, and OChem was one of my faves. I used to build models for fun and write down pathways. And And also, actually, you didn't know this either. My family, most all of them are dentists. My dad's a dentist. My stepdad's a dentist. My brother's a dentist. Like tons of dentists in the family, and I'm the black sheep. This is the medical doctor guy that knows how to put arms back into place when they get dislocated and do all that other stuff. And you're the real doctor of the family, you know. And they always make fun of me because I, for 20 years, didn't have a regular lifestyle like they did. You know, they work Monday to Friday or Monday to Thursday, and they're like, see ya.
Totally.
Sorry, you got to work tonight. But the cool thing is in all of that, especially now, there are functional dentists, you know, integrative dentists that, I mean,
we just saw
gut health starts in the mouth. I mean, gut health starts in the mouth, and most people dismiss that. And now we actually have some science to back that. So how cool that you share that. Talk about, I know as a kid, you struggled with, I believe, GERD or reflux or peptic ulcer disease, whatever it was. And they were having you on all kinds of, you know, the usual, right? Acid suppressing medications. And you decided that, hey, that wasn't going to be the answer and good for you. And then how about the women's health piece? Where did that kind of roll into the sort of specialty mix?
Yeah. So when I was a kid, I had reflux and gastritis. So I actually had an endoscopy, and they were like, we don't understand. You're 7-year-olds don't get gastritis.
Oh my gosh.
This doesn't make any sense. And so, you know, it was a lot of like proton pump inhibitors. These were not studied in kids. Like, I don't even want to read the studies that come out being like, that was a bad idea. Like, you should not have done that to a child. And yet I couldn't sleep because I'd have so much acid, and I missed school because of stomach aches. It was like I missed school because of stomach aches. Then I got my period, and I missed school because of, you know, my period. It's like, when did I go to school is what it feels like. So with that, what turns out I had was H. pylori before H. pylori was actually discovered and made its way into clinical practice. And so when I was 17, a doctor that I saw again after, I mean, I went to so many doctors, and at this point, my mom wasn't even going with me to the doctor anymore. I was like, I'm just not going to stop until I get help, because this is not normal. This is not right. Even though I was being told like, this is just probably how it is for you. And this doctor was like, you know, there's this new organism that we've like learned about. It's called H. pylori. It leads to ulcers. And I'm like, okay, great. Like, can I get diagnosed for this? And at that time, another endoscopy. So at an endoscopy, they took tissue samples, and lo and behold, I had H. pylori. I was treated for it, discovered an amoxicillin allergy, not the fun way. Had to go to the ER because I was covered in hives and losing the ability to pull in oxygen because my throat was swelling. So that was not a fun experience. But when it was all said and done, they were like, hey, you're going to have to stay on these proton and pump inhibitors for life. Like, this is what we know right now. And I was like, well, what do you think about diet? And my doctor, as doctors still do, was like, that doesn't have anything to do with it. It's not going to matter. And I'm like, see, but like when I eat pasta and I drink orange juice, which is kind of gross. When I look back, I'm like, who's drinking orange juice and eating pasta? I get really bad heartburn. When I eat a lot of refined carbohydrates, I get really bad heartburn. They're like, well, no, grains are good for you. I'm like, yeah, but I feel awful. Like, what's going on? So that's when I just started to experiment with my own diet. I'm 17 at the time, just like figuring out like what things work for me, what things don't work for me. I'm so lucky that like as a kid, I always loved vegetables. So it was gravitating to like, okay, I need more vegetables. I don't need any fast food. Like that is that's like such a blessing that my teenage self was like, I can't do fast food. And I really had to make those dietary shifts. At 18, I became a registered dental assistant. So I had my first medical license at 18 years old, was working in a dental office. But I was still struggling. I was really still struggling with gut health, and they couldn't figure out, they never retested me for H. pylori. It wasn't as easy to do. You know, now we can do breath tests, we can do blood tests. Like, it wasn't easy to do. They're like, we have to really put you under again and put a tube down your throat. And fun fact, there's like, I have like a red hint in my hair. You can't tell by looking at me, but, I go through anesthetic like nobody's business. So you can't keep me under, wake up during endoscopies, woke up during my wisdom tooth extraction, woke up, during my tonsillectomy, which they ended up cauterizing the entire roof of my mouth because I decided to talk during that part of the procedure. Woke up in the ICU. They're like, we can't give her any more morphine. Like, she just keeps waking up. And like, at this point in my life, I'm like, unless you like really have to numb me, like don't even bother, because it honestly hurts more to get the anesthetic sometimes and like go through all of that than it does to just be like, I had to have a mole biopsy, and I was like, let's just try to do it. Like, because it just like, I never stay numb. And thank you. I've never had to have a dental procedure. Yeah. So anyhow, that was a whole lot.
Wow.
And the women's health piece was really just like the epiphany of sitting in med school thinking like, why is women's medicine done this way? And my instructors were a lot different. Like when we were taught pap smears, we were taught to ask for consent. And we had a whole conversation around like, we have to lead the consent conversation. So mind you, this is like 15 years ago of saying like, we need to ask our patients, is it okay if I touch you? Is it okay if I insert the speculum? No one ever done that with me during a pap smear, but my provider's saying like, we have to lead this conversation so women know that they have a right to refuse, that they have a right to their bodies. It's things like that I'm like, why is this not how women's medicine is done? I mean, there are still states where if you go under, so you're getting a tonsillectomy as an adult, like I did, you go under and a bunch of residents are going to practice a pap smear on you. There's zero consent for that. Like you don't even know, you wake up and you're like, something's different and nobody even tells you what happened. So that's a big reason why I got into women's health is I was like, I can do a better job and women deserve that.
Yeah, no, totally. Couldn't agree more. The whole story about the anesthesia. I mean, I guess your liver is amazing. You know how to metabolize everything like nobody's business.
In a bad way, though. Sometimes people are always like, "Oh, that's so cool," because like in my 20s, I could drink like anyone under the table. Like, and I don't recommend this to people, especially with what we know about alcohol. But like, I was 20 something, and what do I know about life? And with that, though, people are always like, "Oh, that's so great." Except what they don't realize is that if phase 2 gets like really hot and heavy on like phase 1 gets really cranking things out, you have more harmful metabolites. So those metabolites can be causing, damage to your brain, to other tissues. And so, I have to like really tend to that phase 2 as we all should to just make sure. And like, it's a double-edged sword where it's like kind of cool. They're like, I can metabolize things so quick. Like I can drink coffee at 10 o'clock at night, like other cultures do, and go right to bed and have no problem. Whereas compared to my husband, he's like, he drinks coffee at like noon and he's like up all night. I'm like, we are just like polar opposite in that way. And he's always like, I want to be like you. I'm like, yeah, until you make like bad metabolites. And then like, you're like, oh, why do I feel so bad? Why do I feel like, my brain is hungover and I didn't even drink?
Yeah, you're great with the first pass. And then after that, you still got to deal with all the downstream stuff. So yeah, that's
totally.
I'm with you. Just because you could drink like a fish doesn't mean you should, because we all know alcohol is a poison. It's literally a toxin. It's a toxic alcohol. I mean, that's it's still thankfully the teaching, but for some reason it's such a normalized thing. And it's still, I love what Daniel Amen always says, is that it's no matter what, you are shrinking your brain. Doesn't matter how much you drink. It doesn't matter. It's
when he shows those brain scans, oh my gosh, I'm always like, ugh. And I think about him. When I'm at parties and people are like, oh, let's toast. And I'm like, I don't know. I've seen the brain scans, friends.
I know, it's crazy. So let's get into a little bit about the women's hormones and the cycle, because I want to talk about the post sort of pill, syndrome. When you've been on the pill for years, many women are, and we're not judging because there's a lot of reasons to be on the birth control pill. We're just sort of affectionately calling it the pill, right? Everybody kind of calls it the pill, but I've always called it an oral contraceptive pill, or OCP, what have you. But it's a birth control pill, and that's been prescribed for numerous reasons, whether it be for pain, for quote unquote regulating your cycle, which is kind of a misnomer in and of itself, as Dr. Jolene knows. But let's just talk a little bit about the pill, the post-pill syndrome, and why, let's just get a little bit basic and talk about the women's cycle real quick, just for a second, to set the tone for the rest of this discussion. Well, we will later get into menopause, perimenopause, all these interesting things as well. But maybe let's just start with the basics about the women's cycle.
Sure. So if you're listening to this and you're about, I'm going to share all this stuff and you're like, I didn't even know all of that. Understand that I had to go to medical school to actually understand how my body worked. And I had taken physiology classes, like I had taken all these classes, and I just was like, the way it was presented to me, these were all men teaching it. They were like, it's so complicated. It's not worth trying to understand it, like the nuance and how all of this works. And it was never taught very well. I've set out a mission to make sure that every woman understands her cycle and how her hormones work. So the way that we teach about the cycle is we start from the period, but it's important to understand that the cycle actually starts with ovulation. So ovulation is the key event, and it is after ovulation that you have a period. So why do we teach it opposite? Because a period is really obvious. It's really obvious to know when you're on your period. And Because as doctors, the first thing we're going to ask you is, when was your last menstrual period? And we want to know that. So period is what we call day one. It's the first day you have flow. So if you have a little bit of spotting and that's lasting like several days, you could have a low progesterone issue. If you spot just like the day before, no big deal, but that's not really the start of your period. So what's happening day one? Our hormones are dropping. Estrogen and progesterone, mainly progesterone, is going to drop. And it's going to cause the endometrial lining to shed. Now, while your uterus is doing one thing, it's shedding, you're having your period, your ovaries have a completely different agenda, because all they care about is like get to ovulation and ovulate an egg. So your hormones don't stay low for long. By day 2, okay, second day of your period, we already see a significant rise in estrogen happening. And that's because FSH, the brain hormone, is telling the ovaries, get a follicle ready. So follicles are what hold the eggs, and the name of the game is like get to ovulation. So estrogen is going to rise, and we're going to see that even following your period, estrogen goes higher, testosterone's following. This is why we're getting in the mood, because there's no progesterone around. These two hormones are affecting our brain so that we're fantasizing more. We are more sexually, we're more inclined to have sex, but we also have more arousal taking place. It's no mistake, because you're about to ovulate. So the body's like, we have an agenda here. So right before we ovulate, what we're going to see is estrogen rises. That spike in estrogen tells the brain, we're ready. Okay. Egg is ready. The brain says, let's release luteinizing hormone. Luteinizing hormone, it goes down to the ovaries. And if anyone knows Clash of the Titans, and it's like, release the Kraken, that's what it's like. The LH is like, release the egg. And at that point, about 24 to 48 hours of that LH spike, we're going to see an egg is released, and it lasts 24 hours. That's it. So you're only going to get pregnant in that 24-hour period. People are always confused by this because, and I break all of this down, by the way, and is this normal? And I even do the math for you. Sperm can live 5 days. Your egg can live 1. 5 plus 1 is 6. 6-day fertile window. But you, my friend, if you want to become pregnant, you only have 1 day to make that happen. So what happens to that egg? If it's not fertilized, it degrades, it's gone. But what's left behind in the ovaries is a temporary endocrine structure known as the corpus luteum. And the corpus luteum is what produces progesterone. The only way to progesterone is via that corpus luteum. You must ovulate. So we have progesterone becoming the lead hormone now in the luteal phase. We still have estrogen around. And if there's not enough progesterone, that's when we have those PMS symptoms. We don't feel great. It's not that necessarily like, oh, estrogen's the devil, like she makes you feel so bad. It is that there's an imbalance there. And so progesterone will carry you through. The LH that was there before, that's pulsing and telling the ovary, let's keep the corpus luteum specifically, let's keep producing progesterone. If there is no implantation because there's no fertilized egg, or there was something wrong with conception and genetically it could not implant, we don't get HCG. So no HCG means that LH is only going to last so long. Now the hormones drop and we're right back to our period. So there's a whole lot going on for you to get to a period and for you to have a menstrual cycle. When you're on the pill, none of that happens. The birth control pill is a large enough dose of hormones coming in that it shuts down brain ovarian communication. No FSH, no LH, no corpus luteum, because that's how it works. So you don't get pregnant. The primary mechanism is you do not ovulate. So there's absolutely no progesterone being made or being taken. It's progestin only that comes in through these pills. And that has some benefits, like it helps with thickening the cervical mucus to prevent sperm from passing, but it doesn't have the same benefits of progesterone, like nourishing the brain. So that's important to know. So that's the big difference there. And why I'm always like, we have to be specific about that. Pill bleeds are not periods. Like when you withdraw from that medication, it's not a period because it's not a cycle, because you never had ovulation. And the big reason why that matters is because all day, every day, doctors tell women, you must have a period. Periods matter. But when women get on the pill, we then tell them, you don't need a period. Periods don't matter. And they're like, what? Which is it? You don't need a pill bleed. You're not building endometrium in the same way. It's not necessary. But if you're off the pill, it's absolutely necessary because of the estrogen stimulation happening to the uterine lining. And because it's a sign that something is wrong in the body if you are under 45 and you're not menstruating.
Yeah. So that was a lot to digest, I know, but it's
A
actually
lot. Go back and listen,
fairly,
people.
fairly simple, and it's all going to be in the book for you all. And she was kind of referring to the difference between a progestin only pill versus the classic OCP oral contraceptive, which has estrogen and progesterone. So there is a little bit of a difference.
Oh, it actually
there.
only has progestin. So the combined oral contraceptive pill only has progestin because you can't patent progesterone. So that's the big reason.
Yes, that's got it.
Yeah.
Yeah, that's correct. And progesterone is what we got in our body. Progestin is what they make in the lab, and you get in the form of a pill. Yeah, sorry, I didn't clarify that.
Absolutely.
But so in that whole process, I think the thing that is interesting and really important to remember is that you're shutting down the communication between the brain and the ovaries, essentially. It's not existing in the usual feedback mechanism that happens when you're not on any of these pills. And so tell us a little bit about what are some of the downstream negative effects of not having that communication there?
Mm-hmm. Well, the big problem is how we use the birth control pill these days. So it was first developed so that you could delay or space pregnancies. The intention was that you would always get pregnant at some point. The manufacturers of this were not like, hey, if you want to live a childless life, they were like, this is short-term use. We want to space pregnancies. So just important to keep in mind, that was the intention in developing this. And so with that, the way we use it now is for symptom management. And so often women are going into their doctor and it's basically the algorithm goes, you have period problems. Do you want a baby? If you say yes, they're going to figure out what's going on. If you say no, they're going to say, okay, let's put you on the pill. You've got acne. Do you want a baby? Yes or no? You've got, hair loss, like you've got any kind of hormonal issue. Do you want a baby? Yes or no? Which is, I think, a big disservice to just, say like, well, whether or not you want a baby is going to affect how seriously I take this. And if you don't want a baby, I'm just going to put you on birth control. And the problem with that is that it masks a lot of things. So PCOS, for example, roughly 10% of the population that we're actually screening, have polycystic ovarian syndrome. They present with acne, irregular periods, maybe hair growth on their chin, chest, abdomen, hair loss on their head. And for them, they're often passed the pill, told this is going to fix your period. So quote, fix your period, but never a conversation is had about like, you have a complex metabolic endocrine disorder that can lead to heart disease and diabetes. And by the way, it can make it more difficult to become pregnant. So then when you're like 35, you decide you do want to have a baby, you come off. And for the first time in your life, you're faced with the fact that like, one, you have a condition that has been left unmanaged for years. And so your ovaries have been bombarded with insulin. And it's really problematic because in some people, the pill can cause mild insulin resistance, mild inflammation. And with PCOS, you already have issues of inflammation and insulin resistance. So that's one of the big problems that we see. I think the other big problem is that women are not told about everything outside of strokes, right? And then maybe they're not even told about blood clots and strokes, right? You worked in the ER. I have had a lot of people write me stories about how they went to the ER. No one even asked if they were on the pill when it came to their headache or their shortness of breath. And especially recently with COVID going on, everybody was assumed to have COVID. And there were women who were like, no, I had a pulmonary embolism. Like I had a clot in my lungs because of birth control. My doctor didn't even tell me this was possible. And, the doctors are like, well, it's such a low risk. Like, why would we talk about it? You have to talk about it. You have to talk about it. But I feel like those are the things that do get talked about. The issues like the inflammation, the nutrient depletions that can happen, like zinc, magnesium, B vitamins, like folate and B12, antioxidants like vitamin C, vitamin E, CoQ10. These aren't talked about. Doctors aren't going to counsel you about your diet or maybe being on a multivitamin or prenatal or the impacts on your gut microbiome. And let's face it, I mean, back when I was studying nutrition, the gut microbiome was just taught to us as a bunch of freeloaders that really only made a little bit of B12, vitamin K, but other than that, they were worthless. That still kind of continues in doctors' minds. And so either like, the impact can't be that bad. We haven't seen enough studies on it. And yet, in Beyond the Pill, there's a whole chapter on gut health where I show the research, like back in the 1970s, the impacts on Crohn's disease, ulcerative colitis. So seeing, when we see inflammatory bowel disease, Crohn's disease specifically, there's more incidences of having surgery if you're on the pill. there's a higher risk if you have the genetics that you're going to go on to develop that if you take oral contraceptive pills. And we know from the research, some research has compared it to an antibiotic. Like that is what it can do to the microbiome, because while we're swallowing it, taking it, we're not absorbing all of it in our small intestine. It's actually making its way into the large intestine. And by the way, no one has ever studied what happens when we metabolize it. How does that affect the microbiome? Like there's so many question marks with it, right? Of like, we use it ubiquitously. It's been around for generations. And yet there's so many unanswered questions that so many people don't want us asking. They just don't even want us asking these questions because they're like, you're going to scare women, or like, just be grateful you have it. And I'm like, I'm tired of the conversation of like, just be grateful that you have access to things. I want to have access to it, and I want the full story.
Yeah, no, having the full sort of backstory on what it is that these can actually do. And I'm right there with you. I mean, typically the one thing that is mentioned, and it's usually just the question gets asked, do you smoke?
Yeah.
And if you smoke, then it's like, okay, you can't be on birth control because that's going to really increase your risk of blood clots, which it will. But even in those that don't smoke, which is at least half of us or more, hopefully, we are also going to get increased risk of getting blood clots, whether it be a pulmonary embolus or a stroke. I mean, one of the reasons I left full-time ER medicine was because I felt like we could do so much more. I was seeing 30-year-olds and 40-year-olds, and I'm turning 50 next year, as many of you know. And I was literally seeing men and women alike having first-time heart attacks, first-time strokes in their 30s and 40s, and thinking, what in the world? I never saw this 25 years ago when I did my training. It was always 60, 70, and 80-year-olds that were having heart attacks and strokes. And now it's these young folks that I consider quite young because they're younger than I. Like, what the heck? And you're right. People don't know the true risks, the true effects. I mean, all the downstream consequences. You mentioned a lot of them, the nutrient absorption issues, as well as gut health ramifications, which decreasing the diversity that exists in the gut, which is not a good thing, and all of the other myriad of issues that exist because the lack of communication that should be happening between the brain and the ovaries, et cetera, et cetera. And so let's just use that as a segue. You were talking kind of about this whole concept. Now, let's say somebody who's been on oral contraceptives or the pill, birth control pill, wants to become pregnant. I know typically, there's a window where you should really try to prep yourself, whether it be 3 months, 6 months, a year. There's a lot of things that women could do to kind of increase their odds. And they were mostly never told this ahead of time. Like, oh, just take the pill because it's just the thing. It's easy. It's available. And nobody ever told them at the outset, well, if you do want to get pregnant, here's a process. And maybe we can speak to that with your expertise and the post-pill syndrome and all that stuff, kind of wrap that in.
Yeah, this is such a great question and a great conversation, because what are women told? They're put on the pill as a teenager, maybe early 20s, and they're told, hey, as soon as you come off, you'll get pregnant. Maybe. It depends on what's going on. Like if your painful periods are actually endometriosis, then that may not be true. If your acne is PCOS, that may not be true. If your regular periods is actually hypothyroidism that's not being diagnosed and treated, not going to be true. And so the thing that I think clinicians fail to recognize in having that conversation is that someone may be on the pill for a couple of decades. They may be going on the pill and they're not coming up. They're like, my doctor said I could get pregnant right away. And I'm 34, so I'll just come off and I'll get pregnant right away. And so what's tricky about that is that, one, we have underlying conditions that we know lead to infertility that could have been masked by the pill. Two, as we get older, we deplete glutathione, or excuse me, CoQ10 is the one I meant to say there. We deplete this nutrient. We're starting to not manufacture as much CoQ10. CoQ10 is a really important antioxidant. It protects your egg health. We know mitochondria are really important for the ovaries. They're also declining. They depend on all these nutrients that birth control has been depleting. And so when you come off of birth control, we're at an advanced age. And like, I hate that. So everybody, like, I just had my last baby at 40 and I freaking hated this, oh, you're geriatric. And I'm just like, oh, you don't like teeth? Is that what you're saying? Like, say that to me again. So see, that's the Latina in me. You're like,
my wife got that on the last two, Dr. Jolene. My wife got that. Yeah. She was advanced maternal age geriatric pregnancy at 40. Like, what in the freaking world? Like, she's the picture of health and she's called a geriatric. Like, those are fighting words. I'm with you.
I know, right? Oh, everybody like hates that. But this is the reality. And so it makes it confusing because women come off the pill and they're like, my doctor said I could get pregnant right away. And there's so much more to it. And it's really easy to jump on like, well, birth control must have caused my infertility, when it's like, actually, it's much more complicated than that. Because like, there's also been the lifetime of environmental toxin exposure, like how you've lived your life, like all of these things impact your egg quality. And we also understand that if you had these conditions, it wasn't that birth control caused your PCOS, caused your endometriosis, caused you to be infertile. It's that it masked those, it hid them. So you didn't get the diagnosis, you didn't get the treatment you needed. And so in terms of a protocol for that, in Beyond the Pill, I actually outlined a protocol. It is definitely best if we can start a year in advance, but like not everybody makes their plans that way. And sometimes you get the baby bug and you're like, but I need a baby now. And so giving yourself at least 3 months is really key to help with the eggs. Whatever you're doing for your body, your partner should also be doing. So if you have a male partner, I mean, like for how long was medicine like, women, you can't get pregnant, go get IVF. And it's like, yeah, except that like the male factor contributes to the health of the baby, to the rate of miscarriage, to your actual ability to become pregnant. And so all of that matters. And that's why I'm like, that's like the thing that makes it like really easy is you both need to eat a nutrient dense diet. Lots and lots of plants, high quality proteins. If you can do the organ meats, like even better, because like beef heart, best source of CoQ10. If anybody just was like, ugh, I feel you. You can get your butcher to take like 25% beef heart, grind it up with like 75% of grass-fed beef, give the most delicious burger ever. And you're delivering so many nutrients with that. And you won't even know. You won't even know, friends. So eating in that way, stopping drinking alcohol, if you are like smoking anything, anything of any kind, for people to understand whether it's vape or whether it's smoking, like we are increasing free radicals. Free radicals hate sperm, they hate eggs. Like they just hate them. They go rip them apart. They piss off your mitochondria. Like you're not going to be a fertile person. And then looking at like other lifestyle factors, like things that people know they should be doing, right? Sleeping, exercising, sunshine, community, all of these things matter greatly. And, it's something that I see a lot of people jumping to supplements. Like I have a supplement company and I could talk to you about supplements, but if you're not doing this foundational stuff, like supplements can't take you as far as your diet and lifestyle can take you.
Yeah, no, couldn't agree more. And it's in the name. Supplements are meant to be supplemental. And I take supplements as well, but that's not my food. It doesn't replace food. Is my hierarchy. That's the top of the list. Supplements are down below. And a couple of things I just want to echo and reiterate that you shared is it's just as important for the men to do all these things, because the fertility rates in dudes are dropping like crazy, as in women. In the last 100 years, over 50% our fertility rate has dropped, and nobody's talking about it. We're not doing anything about it. Sperm counts are down. The motility is down. All the things, like it's crazy to even think that magnitude of this decrease, literally 50% drop in fertility rate, and it's rarely even talked about in men and women. Like what the heck? And
men these days, they have 50% of the sperm that their grandfathers had. Like that is just mind blowing. And that as a species, we can be classified as endangered. And I don't think people really grasp that. And that's not coming from me. That's not my opinion. It is the researchers who are leading this, who are primarily studying endocrine disruptors, right? We haven't even touched that subject yet. And I touch on it in every book I have, but the new book, I'm like, let me break it down. Like if you don't care about fertility, let me tell you how it's affecting your sex life and your hormones and all of these other aspects of your life that you should definitely care about. But it is just really sobering. Like when I was reading that I'm like, wait a minute, we could be classified as an endangered species because by 2023, or here in 2023, excuse me, we are seeing such a decline in fertility. And the rate at which it's declining is so drastic. It is not like we're gradually we are dropping off a cliff right now. We are in a free fall. And if that makes you freak out, friend, I freak out too, because like we have got to do something. And with the information that like even you and I are just talking about right now, like an individual can start to turn that around.
Yeah. And we should care whether or not we're planning to have kids. I mean, my wife and I have 6. We're not planning to have any more kids, but you better believe it. I care about what my sperm counts are and my testosterone and all those things. Like that's really important. My virility. I mean, it's super important to me. It's important to most people. I think whether or not you want to have kids, you should care about your overall hormonal health. And that's kind of what we're getting at here with Dr. Jolene, is the true importance of hormonal health. And that much of it is, I think, overlooked because we never get down to the root, right? The root cause of why do we have so much hormonal issues? Well, it's all the things that she just mentioned, right? It may be a lot of our exposures. It may be our crappy standard American diet, like all of these things. It may be we're not sleeping well enough. We're not getting outside and going for a walk. We're not seeing the sun. All these things play into it. And, we talked a lot about the pill and the cycle. I want to talk at least for a quick couple minutes about sort of the perimenopause, the menopause, and that kind of time frame, because I think a lot of women have a lot of questions. And I think, at least in my 20 plus years experience, a lot of those things are changing, and not for a good thing. People, we're seeing, the data shows women are starting to get into those perimenopausal years earlier. I don't think that's a good thing. We'll see what you think. And things can be lasting longer. They can, symptoms that they experience, which are not awesome, right? All the hot flashes, the difficulty sleeping, all these kinds of things. There's a way to optimize all of this. So maybe take it wherever you want. Let's talk a little bit about the perimenopause, menopause, and sort of how to best optimize these amazing years.
Totally. Well, let's first define them, because it's very confusing the way everyone talks. They're like, I'm having menopausal symptoms. And it's like, okay, well, we're actually having perimenopausal symptoms. So let's get into it. Okay. So perimenopause can start roughly 7 to 10 years before menopause onset. So menopause is accepted to be normal at age 45. That means at age 35, you may begin experiencing insomnia, hot flashes, night sweats, experiencing the brain fog, experiencing loss of memory. Like, where did I put my keys? That might be happening to you on a daily basis. And medicine does this rhetoric where they're like, that's normal. You're getting old. Welcome to perimenopause. Except none of that's normal. And what I don't hear anyone talking about is that all of those are signs that your brain is struggling, that your brain isn't getting the hormone stimulation it needs to thrive, because you need those hormones for brain health. And I hate to be the one to break it to you if this is the first time you're hearing this, but women are the largest population with dementia. So all of these signs and symptoms that have been chalked up as like, that's just the way it is, they're actually signs of brain dysfunction, and we should be intervening earlier. So we can see perimenopause 35 to 45. It may start when you're 40. You may go into menopause at 50. What is menopause? Menopause is the cessation of ovulation, therefore menstruation, for 12 consecutive months. So if you're someone that's like, I haven't had a period in 9 months, and then I have a period, sorry, we reset the clock again. It's got to be 12 consecutive months. And at that point, you're in menopause. If that happens before 45, that's considered primary ovarian insufficiency or something else that is not menopause. And if your doctor's like, oh, you're 41, you're in menopause. No, you are not. No, something else is going on. And the younger you are that you lose your cycle, the more detrimental it is in terms of morbidity and mortality outcomes. So this is all really important to understand. I don't think enough people are talking about this. Enough people are taking this seriously. I think that a lot of the conversations around perimenopause and menopause is like, it's a natural process. Therefore, just let it be natural. And it is a natural process. We do have to ask the question, why are we still going into menopause at the same age, yet we're living longer? And there are researchers who are now like, we can delay menopause. Like, we think we can get there and delay menopause. Spoiler, so much of it is going to be this diet and lifestyle that we've been talking about, and really taking care and tending to your mitochondria, because a lot of people hear about how mitochondria, they're the powerhouse of your cells. They make energy. That's what we're all taught in biology. There's so much more than that. They're concentrated in the brain, but the other place they're concentrated is in your ovaries. And so if you want to have good hormonal health, you have to be tending to all of the things we already talked about, right? And I go through this in Is This Normal? So in a way that isn't overwhelming and feels achievable for the average person, because it certainly can all feel very overwhelming when we start talking about like diet and lifestyle, and you're coming from a place where it's like, I don't know the first thing about nutrition, and I don't exercise. And there, the thing that I think people really should hook into and understand is that it's not being like the influencer you see on social media. I always laugh, like there's a quote, I can't remember where it came from, but of this woman saying like, these 20-year-old influencers are like showing off their perfect body. And we're all laughing because we're like, yeah, we could not sleep. We could binge on like, the worst food possible, like you name it. And we would look like that because we were younger and our cells were younger and our body had a resiliency that doesn't have now. I'm always like, and the quote is like, show me a 50-year-old, show me a 50-plus-year-old who's doing that. And that I will applaud, because the reality is that so many people take this all or nothing perspective. And really, it's those little tiny steps you take every day that keep you out of the doctor's office.
Yeah, no, it's definitely those tweaks, and it's over time, right? All of this is over time. Like that's why, like you said, the teenager has this resilience. They don't have the same toxic load and burden that you and I have in our 40s and 50s. Like this is just not the same. We have so many other, additional exposures, whether it be from our food or we're just, or whatever. Yeah. Or those Friday and Saturday night happenings, like whatever it is. It's not, no. And that I couldn't agree more. It's so interesting that at the end of the day, hormonal health actually can be pretty darn simple. And I think you're quite expert at sharing that. Both, in your previous book and this one, it really just dialing in, like, it doesn't have to be overcomplicated, though many people make it out to be. It doesn't have to be. And certainly the biggest levers I think that we have access to as humans are not complicated, right? That's the stuff that you've shared many times over. The diet, what we actually eat. Is our food the best possible medicine, or is it a poison? Like we get to pick that every day. Are we moving our body or not? Are we getting a good night's sleep or not? Are we optimizing our stressful life? We all have a very stressful life, and the last few years has really brought that to light for many people. We've had a stressful life for a long time. Are we paying attention to our gut health, which you're also expert in? And so I hope that that all the listeners, viewers will get that message that actually it doesn't have to be complicated. And you're a perfect example of how we can see these things clearly in such a simple way throughout your work and what you've been doing for the last couple of decades. I thank you and I honor you, and I think you're doing a great job. Keep crushing it. And tell us any parting thoughts that you'd like to share. And then, of course, how can people reach out to you and grab that new book? Is This Normal?
Yeah, I think so. Number one is the book is called Is This Normal? Right. And it's going to give you all of the answers to the questions that I'm most commonly asked. And the book is broken down into 3 parts. It has your sexual self as the beginning, your cyclical self, and then it marries it all together in the 3rd section, which is a 28-day plan to help you really understand you and build your user manual to you. And I think when you get into it, my hope is for you to understand that you are the only one who's going to be able to understand what's normal for you, outside the things that are definitely pathological, that I'm like, this is time to go see a doctor. And that's what I really encourage everyone to do, is ask themselves, what is true for me? And recognize that you're not going to be exactly the same as your partner, your neighbor, your friend. You're not going to be the same as everyone else. You're going to have those variances. And in recognizing that, I also want you to recognize that you are an expert in your body. So when things come up and maybe your doctor says, well, that's normal, it's not normal for you. That's outside of your normal. And I would always encourage you to advocate for yourself about that. So you can find Is This Normal anywhere books are sold. You can also find me on drbrighten.com. on Instagram at Dr. Jolene Brighten, same for TikTok and YouTube. And it's at Dr. Jolene Brighten, and Brighten is Brighten for those who are curious. And I would love for you to come and join my community and ask any of the questions that you might have, especially after reading the book.
Yeah, amazing. No, thank you for that message. I think that's so important because we're all different, right? There is no quote unquote one normal. I mean, even when we get those dang lab tests and it's like a normal range, well, the really disappointing thing is that normal is actually not normal anymore, because when 88+% of us, probably 93% of us now post COVID, are not metabolically healthy, how do we even call that a normal range? Like, you don't want to be normal. Trust me, you don't want to be normal. But this is a great example of how we are the best judge of how we are doing. Like you just said, you are the expert on your body, and don't let anybody tell you different. You may have to swap out your doctor. I mean, I'm just saying, and it's totally fine if you do. You got to have somebody that will at least give you that credence that you are expert in your body, and you should be involved in the decision-making, which is what we've talked about from the very beginning, that many years we've kind of ignored this, I think, in medicine, especially Western medicine. I'll be, able to speak on that because I've seen it. I've sadly done it maybe a time or two, not a lot, but especially not in the last decade, but we don't give full disclosure. And I think we should. And people like you got to be your own best advocate. So you are your own expert. You've got this. It can be simple. Dr. Jolene is here, right here with you. All of the links and such will be in the show notes. And I just want to thank you again for doing what you're doing, for getting this word out there that's so critical. And dudes out there, you should be buying this book also for your significant other, for family member, friend, whomever. You should read it so you understand better what's happening, because it'll pay dividends. I promise. When I've been married 25 years, and my mantra is one that was given to me is happy wife, happy life. And it's never let me down. So trying to understand my wife better with books like these has been critical. So thank you, Dr. Jolene. What a pleasure.
Yeah. Thank you so much for having me. This was a wonderful conversation. I appreciate your time.
Yeah. Big aloha all. Thank you. Thank you.
I hope you enjoyed this episode of the podcast. Please make sure you hit the subscribe button and the notification bell so you never miss out on any future episode. And I'd love to hear your comments and feedback. If there's any topic you'd love to hear about, you're dying to know, burning questions, please comment below and let me know what future topics are of interest to you.